Every organ system has got the ultimate role of contributing towards homeostasis. And in that sense, every organ system is equally important in the scheme of body physiology. But if I was asked which organ is smart and sensitive and sensible, then my vote goes for kidney. Every organ system or every organ has got a primary role, primary function, and some secondary roles to play. So every organ plays its roles in a very narrow domain. But if I was asked which organ has got a very diverse array of functions, a variety of actions, then again my vote goes for kidney. So let's have a look at some of the functions of the kidney other than its primary role of excretion. We are talking about non-excretory functions of the kidney. This is also asked as a short note in universities, 5 mark, 7 mark question. So let's have a look at non-excretory functions of the kidney. First, blood pressure regulation. You know, we have short-term regulating mechanisms, intermediate term mechanisms. Kidney acts in a long-term manner to regulate the blood pressure. There are two aspects to this function. Kidney activates the renin-angiotensin-aldosterone system. You know, the JG cell in the kidney releases renin, which then acts on the angiotensinogen to form angiotensin 1, and eventually this will convert into angiotensin 2. So angiotensin 2, which is a vasopressor, and it will increase the blood pressure. In addition, it also causes secretion of aldosterone, which increases the sodium reabsorption and water reabsorption. So in such a manner, kidney is going to regulate the blood volume and blood pressure. Also, there is a mechanism called as kidney body fluids mechanism. So in a very smart manner, kidney adjusts the urine output on a long-term basis. I mean, if the normal blood pressure of 100 mm of Hg, mean blood pressure, the urine output will be normal, 1 to 1.5 liters per day. But if the BP is 60 mm of Hg, low blood pressure, then kidney starts conserving water, and therefore the urine output will be virtually zero. And if the blood pressure is 160 mm of Hg, then the kidney will increase the urine output to 5 to 6 times the normal per day, and thereby it will decrease the volume of the body fluids. So that's the first role played by the kidney in the blood pressure regulation. Second, water and electrolyte balance. I'm going to draw your attention to a very important aspect in this context. You know, in all our body fluids, solutes and water are inseparable. Solutes are dissolved in water, and therefore they are inseparable. Solutes and water, they are always going together. They can't be separated. But there are two places in the body where solutes and water can be separated. They are separated. And those two places, both of them are in the kidney. Thick ascending limb of loop of Henle, and later on in the collecting duct. At these two places, kidneys can separate solute and water, and then they can decide what to do with this water. So water can be either conserved in the body whenever required, or it can be excreted out. In addition to that, the electrolyte balance. Yes, kidneys will reabsorb sodium entirely. All the filtered sodium will be reabsorbed, and kidneys can decide with the potassium balance particularly. They can reabsorb potassium entirely, or they can excrete the potassium into the urine. So in this manner, kidneys can have an important role in the water and electrolyte balance. Third, pH regulation, acid-base balance. You know, if the pH of the body fluids is disturbed even slightly, it is going to have disastrous consequences. Enzymes will stop functioning, and there will be many deleterious effects. And this is where kidneys play an important role. They reabsorb the filtered bicarbonate. Entirely the bicarbonate will be reabsorbed. Then They can generate new bicarbonates, generate the new bicarbonate whenever required to match the acidic pH. The bicarbonates will be retained or even newly generated. And apart from that, there would be ammonia buffer in the kidney and phosphate buffer, and these buffers will also play an important role, particularly in the conditions of chronic respiratory acidosis. Whenever there are respiratory acid based disorders, kidney comes in and plays this role. It regulates the pH on a long-term basis. Again, ammonia, a very crucial buffer in this scheme of things in the kidney and its acid-base regulation. Next, endocrine function. Well, yes, kidneys play a very important role here, although all the other organ systems also they have a primary role and a secondary role of endocrine function. Even heart has endocrine function, digestive tract has endocrine function. So a kidney also has the endocrine function. Two important ligands are synthesized in the kidney. One, the erythropoietin. Yes, erythropoietin, more than 90% of it is generated in the kidney. Peritubular capillaries, and they are surrounded by type 1 cortical interstitial cells. These cells synthesize erythropoietin, which then goes to the bone marrow and it stimulates erythropoiesis. So very important role in the RBC count, and you know, the RBCs transport the oxygen, so crucial role. Then synthesis of vitamin D3, or the most active form of vitamin D. You know, our skin, when it is exposed to the UV rays, it converts into 7-dehydrocholesterol. Then it goes to the kidney. I beg your pardon, just cholecalciferol is generated from the dehydrocholesterol. Cholecalciferol generated in the skin. Then this cholecalciferol will go to the liver first, and one hydroxyl group will be attached to it. Then it goes to the kidney, where finally its final active form will be generated, 1,25-dihydroxycholecalciferol. So vitamin D synthesis also occurs in the kidney. Always remember, if you happen to encounter the patient of chronic renal failure, apart from the dialysis and other treatment, don't forget about the erythropoietin and vitamin D as well, because they will be suffering from lack of those vitamins, or lack of those hormones rather. Glucose homeostasis. Yes, glucose homeostasis, or let's say metabolic function. Kidney has certain enzymes which can have the gluconeogenesis. So whenever required, kidneys can release extra glucose from non-carbohydrate sources. So gluconeogenesis, an important function of the kidney. So all in all, these are the non-excretory functions of the kidney, and therefore I said at the beginning, a very smart organ with a diverse array of functions. It is asked as a short note in the universities. Remember 5 points for 5 marks and you will get full marks.